so much for being here tonight. Let me know if the mic is too loud or if you have problems hearing me. We're here to talk about the solid link between transportation and health and how we can map out the roads for healthier places. And it actually started a long time ago, the connection between health and streets. The first traffic engineers were actually sanitation engineers, engineering and designing streets for vehicles, sewer, horses, exactly, not vehicles, horse carriages, and sidewalks where you have curbs in order to separate the walking people from the sewer and the dirt and the horses. And one more thing that's interesting is that also led to the concept that traffic is a matter of flow, right? Water flows, traffic flows, and that's how we got the level of service metrics that we have relied on for so long, where it's a matter of traffic flow, and having a level of service A means that there's pretty much no restriction at all. You can go as fast as, or you can go smoothly through the street and the segments you're traveling on. Whereas LOSF, level of service F is where you're stuck at intersections and you can't get through the intersection at the signal before it turns red again, for instance. And this has also led to geometric designs of our streets that allow for truck vehicles or trucks and buses and such that may not be necessary on most streets. They should be on certain streets, but they don't necessarily have to be on all streets. This goes for fire trucks and large other vehicles as well. But what happens when we design for trucks is that we're also making it very easy for smaller vehicles to make turns very, very fast. So by designing for trucks, for instance, we make it easier to travel faster through the intersection. Parking is another aspect of this. As traffic flows, we also wanted to move off the street as quickly as possible. And that has generated a lot of parking lots. And parking was extremely inexpensive at the time in the 50s and the 60s and up until very, very recently, where we have surface lots that don't cost much. Land wasn't very expensive. But today, as where we have less parking or less land available and we need to build parking structures, it becomes very, very expensive. But everyone assumes that parking will be available and free wherever we go because that's what we're used to. And we have therefore optimized our cities and our towns and villages for vehicles to a large degree, where we're separating our uses, we're making wider and wider streets, we're providing more and more parking facilities. That just makes it so much harder to walk and move around and take transit. And this has given us an over-reliance on drive alone, or driving our cars, more or less. And the over-reliance has also resulted in higher rates of pollution, which in turn leads to respiratory diseases, higher rates of roadway injuries, and the lack of opportunities for physical activity in our daily lives, because we are so dependent on our car and getting from one location to the other. And this has also resulted in obesity. And obesity isn't just a result of transportation. There are so many other factors: access to food, healthy food, and the sedentary lifestyle that we do live. But transportation is an important component of that. And this is a map of the US in 1985, and California here has a rate of less than 10% of the population being overweight. That's 1985. As we're moving through these, sorry?
10% obese, not overweight.
Obese. Oh, obese, sorry, thank you. As we're moving through these ones, we have the two categories, under 10% and 10 to 14%. In 1991, we add a category where 15 to 19% of some states are obese. And this continues. In 1997, we're adding another category where 20 to 24% of the population is obese. And it continues. By 2001, we're adding another category where Mississippi has an obesity rate of 25%. And by 2005, over 30% of some states is obese. So this just shows how big of an impact our changing habits have had over the past 25 years. And back to California, we started with less than 10% of the population being obese. And today in California, it's at 20 to 24%. So it's a big shift. And again, this is not all linked to transportation, but it is an important factor in that. And it's not just about obesity and other diseases. It's also about the pedestrian and bicycle safety. And this is a recent study from 2014, now in March, here in San Francisco, where I'm not going to go into the details of this map or this chart, but just looking at the medical costs and the total annual health-related economic costs of almost, or $500 million. So the problem with disconnected cities is that they lead to inactivity and obesity, which in turn leads to other diseases. What we also have a problem with is that our sedentary lifestyle and our frustration from driving, if you saw Jeff Tomlin's speech about how you become aggressive when you're driving, for instance, and you're frustrated when you're stuck in traffic for a long, long time, it does lead to mental illness and depression. And by walking more, we can reduce that. And globally, road traffic injuries is a leading cause of death and disability. By 2020, it will be the third leading cause. If we do generate and produce and design more connected city with a multimodal approach, well, the road safety will be improved. There will be higher rates of physical activity, which will make us healthier and calmer and improved mood. And we will have environmental impacts or benefits as well in reduced vehicle miles traveled and air pollution, which in turn will reduce the respiratory issues that we have today. So many cities are now, including San Mateo and San Francisco and other communities on the peninsula and in the East Bay, are doing a lot to improve the physical design of our streets. And that may be both increasing the space for pedestrians and bicyclists. And since many of these streets have been so wide, there hasn't been a need for the width for vehicle traffic. So this hasn't had a huge impact on how much traffic is coming through. But it has a big impact on the injury crashes. In this instance, Union Square North in Manhattan, injury crashes fell by 26%, while retail is booming. And the same on 8th and 9th Avenues in Manhattan, where 35 to 58% of the injuries, or the reductions in injuries, again, while retail is becoming much more attractive, because it becomes a more vibrant location. And we want to provide facilities not only for the road warriors or the people who enjoy biking for hours. And I used to be in the green field here, where I didn't feel comfortable riding up until just a couple of years ago. But today I've moved into the yellow field. I'm enthused and confident, and I know which streets to use, and I know which streets to avoid. I wouldn't ride on El Camino. I would walk on many sections of El Camino rather than biking there. But things are changing, and we want to plan and design for kids and for seniors so that everyone can bike comfortably on certain streets. In addition to the bike facilities, there are also opportunities to have bike stations where you can park easily, you can get your bike maintained. Santa Monica is a great example. And a bike action plan was adopted in 2011. And within a year, 15 new miles of bike facilities were implemented, and a bike center, and I think a second one is on its way. And some of you have seen these green facilities. Polk Street in San Francisco is an example that just was finished. And if you get an opportunity to take Caltrain in with a bike and riding Polk Street, go ahead and do it. It should be fun because it's an experience having these kind of facilities to ride on. So in addition to design, if we start at the top at destinations, what we can do is to make sure that we can access destinations by many transportation options. If we can walk and bike and take transit there in addition to driving, for instance. If we can reduce the distances between the destinations that we need to reach, and where density fits around transit nodes, in downtowns, in certain corridors that we want to, where we are okay with increased density, and where people can then ease more, and where we create nodes, villages, and community centers within our bigger city. It's not a matter of changing everything, it's a matter of making it easier to make that short trip by bike or walking than having to get in the car everywhere. Diversity, increasing your opportunities to get to retail and health and the daycare and maybe even your job, to be able to get to all of these destinations within walking or biking or transit distance. And then back to design. It is important to make sure that we think of our streets not only as something for vehicles, but rather as really important as part of our public space. And then demand management. How do we encourage people to shift to bus and walking and biking? So it's all about the destinations, the diversity, and the density. Where are the jobs? Where is the housing? Where are services? And how do we access them? Can we get there by transit? And many cities are now doing what Seattle did a number of years ago, and that is to look at transit villages, creating nodes where more and more people can get to that spot by walking and biking and then taking transit to wherever they need to go. And back to the issue of distance, if I live at the center and I want to go to school with my son, I can easily walk up there. But if I live in a cul-de-sac, I would probably get in a car to get to the same location. And I would pick my son up, and I would have to make several left turns, and I would not feel comfortable riding that with my 8-year-old. So just by thinking or designing cities with better connectivity within our city and grid pattern, it's easier to get around. And the other thing is that with this here, we have more streets to choose from. So they don't have to be as wide as the streets are arterials that are so important when we get in and out of our cul-de-sacs, because everyone has to get in and out of those arterials. Connectivity. With a high connectivity, the travel lanes required are fewer and narrower. With a low connectivity, we need many traffic lanes and median turn lanes and both left and right turn lanes and such. And this could be El Camino, and I actually don't know where. I believe it's on the peninsula, but just adding bike lanes, for instance, and considering adding a bit of density in certain locations and housing, for instance, and mix of uses, changes the entire appearance of this street and this node. It doesn't have to be an entire corridor, but in the nodes where you have good transit, for instance, or good access to a lot of destinations, it does make sense, because it becomes a place and not just a vehicle throughput. And we now have the right tools. The National Association of the City Transportation Officials recently came out with this NACTO Urban Street Design Guide, where we have the right tools in order to produce some of and design some of these new and improved street designs. And I want to finish off, before I give the mic to Robert, indicators and performance metrics is very, very important. We need to know where we stand today, what is working today, and we need to know where we're going and what our goals are. And in order to do that, we can start tracking, for instance, collisions per 1,000 people, walkability, and with walkability, we would be looking at intersection density, street type, bike lanes, transit lines, stops. If you tried walk score, it's one way to look at how walkable a community is and how walkable a location in a community is. Looking at bike lanes and the facilities miles as a percentage of total road miles. And commute mode share, how does our employee mode split change over time? And to me, I am experiencing a paradigm shift. We have had the individual interventions where we put a person on a diet and give them a fitness pass, for instance. Now it's time for us to start really thinking about how we can go from the individual level to really thinking about the built environment and the physical activity that is associated with that. And with that, I want to hand over to Robert.
And I'm really impressed with the work that's going on here in San Mateo around redesigning the streetscape to encourage health. But I'm going to sort of widen the lens a little bit right now, take a step back to talk about the concept of health in all policies, because that has become a really big movement in public health and in city planning around the country. I'm not sure how familiar you guys are with that. I don't know, is that a familiar phrase if people want to put up their hands or not? Okay. You're actually part of that movement, so I'm going to explain some of that. I'm going to situate the redesign of streetscape within the larger movement that has become part of public health, which is really to rebuild cities so that the healthy choice becomes the easy choice. What Jessica did was give a really good example, an introduction to what has happened over the last 100 years in American planning and public health, where we started to design cities wittingly or unwittingly, where the healthy choice became the hard choice, and we got to the point where I think it was fair to say that a lot of cities were designed for disease. Now, public health and planning, which began together about 100, 110 years ago to deal with infectious diseases. And the first slide where she showed the traffic engineers were in fact sanitation engineers was exactly right. Things like zoning codes, sewer systems, water treatment plants, that was public health and city planning, both in their infancy, working together in American cities to control infectious diseases. In the last 10 years, they've come back together to try to control not so much infectious diseases, but what we call chronic diseases, specifically what you see here. So as you all probably know, we have very high obesity rates. A little bit of good news is we no longer have the highest obesity rates in the developed world. We have the second highest obesity rates now. And that's not because we've gotten better. It's because Mexico's gotten a lot worse. And Mexico passed us about a year or two. So we're still at the point where about 36% of all American adults are considered obese. About 2/3 are considered overweight. And if you are like me of a certain age, and you look back at your elementary school photos, and you compare them to the photos from your kids that are coming in elementary school now, it's really quite shocking. My kids look at the photos and say, how come you guys were all so skinny? I don't remember being skinny when I was in elementary school. I remember my mother buying me husky-sized pants. Things have changed a lot. And what has changed really is the environment has changed, which has led to behavior change, which has led to change in us. So you see up here in the state of California, there are 3 specific unhealthy behaviors. Diet, physical activity, or lack thereof, and tobacco use, which are contributing to these 4 diseases: vascular, cancer, type 2 diabetes. We used to call that adult onset diabetes, but they stopped calling it that because it's onsetting in children now, so they had to come up with a different name. And lung disease that cause over 50% of all premature deaths, okay? This is what public health is focusing on now. If public health people were talking to you about 10 years ago, they would have been handing out pamphlets to tell you how you can diet. Now they're working upstream in environmental change. And a lot of this is being driven by economics. So you've got your economic development director, Marcus Clark, here, a former student of mine, so you're in very good hands. But I'm going to talk to you about the state's Health and All Policies Task Force. And it was started by Governor Schwarzenegger. And one of the big reasons why Governor Schwarzenegger really chose to focus on public health is things like this. So I don't know how well you can read the different colors of the font. But in 2008, 22.4, so more than a fifth of all of CalPERS medical expenditures were spent treating chronic diseases that could have been prevented through changes in diet and exercise. Okay? Some counties it was well up over 35%. And I don't need to tell you all as taxpayers how much of our state municipal budgets are being driven by retiree health costs. And those are going to get higher and higher and higher unless we start to design places for prevention in mind. And that's really our focus, is prevention. And I am not going to stand here and tell you that personal behavior has nothing to do with it. Personal behavior has a lot to do with it. But, God, it goes in and out. Maybe I should hold it closer. We as individuals exist within all of these sort of boundaries. And my organization has chosen to focus on public policy as a way of getting to the behavior change because we found it works. We started life 18 years ago as a small group of attorneys, and I'm not an attorney, who've written almost all the anti-smoking laws and policies in the state of California. I notice none of you are smoking right now. The reason none of you are smoking, among other reasons, is you're not allowed to. The unhealthy choice has become the difficult choice. Evaluation of this 20 years of anti-smoking work was published last year, done by some UCSF scientists. California now has the second lowest smoking rate in the country, second only to Utah. And Utah's always had the lowest smoking rate because they're Mormon, they don't smoke. Okay? Our lung cancer rate has plummeted, and it's 25% below that of the national average. In the 20 years that California has been actively taking this policy-changed approach, there have been 1 million fewer deaths than there would have been otherwise had the death curve continued the way. The state has spent $1.2 billion fighting big tobacco, saved $155 billion in healthcare costs. That's been a wake-up call. People are starting to think that that is how we're going to deal with this healthcare cost crisis, is by creating places where people are healthier, so we all don't cost as much to insure and treat. So that is what's really driving what we're doing. And so we all live longer. And so those preventable premature deaths, and a premature death is defined as dying before the age of 75. So those premature death rates really start to go down. And so my organization works on all sorts of stuff now, not just smoking. We work on all of these things. I mean, policy decisions that can affect health. Can we increase access to healthy food? That's obviously a health decision. As Jessica just said, what should that new road look like? 10 years ago, no one would have thought that was a health decision. It would have been traffic engineers thinking, okay, how do we get the traffic through as quickly as possible? People now are starting to understand that that is really a health issue. That is one of the reasons, the way streets have been designed, why 87% of American kids never walk or ride their bikes to school anymore. I don't know how many of you used to walk or ride your bike to school when you were kids, but 87% never do it anymore. And there are a bunch of reasons, but the two main reasons that parents cite are fear of abduction and safety concerns. And so what the road looks like, especially the road connecting to the schools, is a health issue. Should the schoolyard be closed in the evening and on the weekends? That's a health issue. A lot of schoolyards are closed, and they're closed for very sensible reasons, because the principal's worried about vandalism or worried about wear and tear. Is it possible to write a joint use agreement, however, to get the school in a partnership, say with the Parks and Rec Department, to keep it open after hours so that the kids have somewhere safe to play? That's a health. Should we develop on green fields or should we infill? This is a huge thing around the state right now. If you develop on the existing footprint, you are building places that are more likely to be within walking distance of where people live. So people are more likely to walk just incidentally. That's what we're really trying to work on in my organization. Building activity back into daily life as a sensible option. How do we pay for changes to our built environment? I'm going to talk about that. I'm also going to talk about how the types of changes to the built environment we undertake can be more or less cost effective. What should school children be fed at lunchtime? Oh boy, this is a big one. How many of you have already eaten lunch at an elementary school? Yeah. I recommend it. It will be an eye-opening experience. I'm not sure what has happened in San Mateo, but I imagine probably a lot of progress in elementary schools. I know a couple years ago when I first started, one of our colleague organizations tried to bring some television cameras into the cafeterias in LAUSD to show what the kids were eating, and the LAUSD tried to stop them. They didn't want it public knowledge what the kids were being fed. And so these are some of the big health issues that we work on. So the state of the field, probably 3 or 4 people in this room who are members of the American Planning Association, maybe more. The American Planning Association has really taken health to heart and is moving forward with it. In fact, last week they had their annual meeting, and the keynote speaker was the Surgeon General. I can't imagine that happening 5 or 10 years ago. This map is about 3 years old, and what it shows is all the counties around the country that had already adopted health language in their general plans. I'm waiting for an update. I haven't seen an update from the APA yet, but I put this up there to show that it's quite common, even 3 years ago, in California, but not just in California. So it's starting to spread. And I mentioned health in all policies as well. I'm going to talk about that very quickly. Governor Schwarzenegger, one of the wise things he did when he was in office was create a strategic growth council. I don't know if you've ever heard of it or if you follow Sacramento like I do. He, for the first time, made a requirement that the heads of all the major state agencies should meet every quarter to coordinate their activities, or at least make sure they weren't getting in each other's way. First time in state history that had to happen. So they meet every quarter now. And one of the things they did was create a health in all policies task force that has been looking across all the different sectors of state government to see how they can alter their policies to try and lead to healthier outcomes. So the Strategic Growth Council I mentioned, all of these agencies, and this is the big one that contains housing and community development and Caltrans, and all of those are all part of this, with the whole idea being sustainability and growth of the state. And they're talking about all of these sorts of issues, improving air quality, reducing greenhouse gases, how to provide affordable housing, improve mobility, and so on. But it's not just a California thing. We've been working in Baltimore, where they've got Healthy Baltimore. Seattle has got Healthy Seattle, and I want to come back to Baltimore. Baltimore is one of a number of economically stressed cities around the country where the leadership has decided that they need to take steps to try and build or rebuild the sort of city that residents are proud of. Otherwise, their most educated, capable, mobile young citizens are going to move away like they've been moving, and their economic future moves away with them. And so Baltimore has adopted a healthy Baltimore, health in all policies approach as the sort of foundation of their economic redevelopment strategy. And lots of other cities are catching on. Democratic cities, Republican cities. The most famous one being Oklahoma City, where the mayor there, Mick Cornett, if you ever watch any of his TED Talks on YouTube, they're just unbelievable, has said to his very conservative electorate in the reddest of the red states, I'm trying to build a town so when your kids graduate from college, they move back here instead of moving to San Francisco or to New York. And that has become the economic revitalization strategy of Oklahoma City. And he's very proud that people are moving from California back to Oklahoma in reverse of the Grapes of Wrath, which he said he had to read in school, and he thought only people in Oklahoma had to read that to make them feel bad about themselves. The Centers for Disease Control and the Robert Wood Johnson Foundation, the California Endowment, Kaiser Permanente, among others, have hired us, law and planners and policy experts, to develop a set of tools that can travel from place to place. So we've been working all around the country on healthy general plans. Lots of them have been adopted around the state and around the country, and we are putting language in a whole bunch of different parts of the plans. One of the obvious places is in the transportation element, and that's what we're talking about, or the transportation chapter, sorry. Element is what planners call chapters. But we realize that if we only put it in the transportation element, other people might not read it. And so in the housing element, in the economic development element, and so on, we are putting in language. There are different types of zoning codes now that are being developed that really emphasize more infill. I don't know how familiar some of you are with the concept of a smart code. Which really looks not just at how the land is going to be used, but what that use looks like. What people have learned, what planners and urban designers have learned, is that if you really want moms to ride to school with the kids, if you want seniors to walk around as part of their daily activity, there has to be a certain look and feel. And so people are starting to write that into the zoning code. Really zoning to encourage activity. For you folks in San Mateo, something I just want to point out, you in the city, we've got a database on our website of what we consider to be the best active transportation zoning codes that have already been adopted from around the country for about 30 different types of things. So for example, access to transit. Aurora, Colorado has done a really good job on bus access as part of their urban street standards. So you can go to our website and then the actual piece of code that's already been adopted is there. You should feel free to steal it. We also work on access to healthy food. We've been doing that in Washington, D.C., where really looking at where the supermarkets are, and what is the walking distance around. And it's really illuminated that there are whole parts of the city where to get to a supermarket, you're really going to drive, right? And so nothing wrong with driving to the supermarket. I do that all the time. But if you're trying to build a healthy city, what you're trying to do is make walking an option for everyday activity. And this is one of the things that is certainly an almost everyday activity, especially if you've got a bunch of growing boys in your house like I do who never stop eating. It really is a daily activity. Eyes on the street. I don't know how many of you are familiar with that concept, but that's really about building places where there are people around and sort of natural surveillance. I don't mean to use the word surveillance, sound like 24 or something like that. But people feel safer when there are other people around and when people can see what's going on. And so Sarasota, Florida has done a really good job of that, and that's in our database also. We talked very briefly. What I'm doing right now is just going through a whole series of policy solutions for creating healthier places. Complete streets, that's really what Jessica was talking about, instead of building streets that are really, really only for the car and the truck, the movement now is to build streets that are for everybody. For the car and the truck, and in fact, sometimes the truck might not belong in your neighborhood street, it might belong on El Camino or somewhere else instead, but for other uses as well, so that everyone can get around safely, irrespective of their physical capability and their age and what mode they're using. So lots of cities, lots of counties are adopting complete streets policies. I know San Mateo County, I think, has adopted one, haven't they? Does anyone want to weigh in on that? Has San Mateo County adopted a complete streets policy? Do you know?
I'm not sure.
I think they have. I think ABAG has required that. Jessica showed you something like that. This is El Camino. You guys can probably tell me where on El Camino this is. Okay, but you see that? This is down in Palo Alto. You recognize that guy? Yeah. So she talked about the impact that a complete streets policy can have on mobility and your comfort. I showed this slide to the Strategic Growth Council, though, and they look at the infill and think about the impact that this can have on the local economy. A place that looks like this is a place that will build a much more resilient city budget. You're going to have a much higher tax collection per acre and a much more diverse set of tax revenue per acre in a place like this. Property, business license, payroll, and so on. And increasingly, cities around California are really starting to look at infill development from a bottom line perspective. You've seen a number of bankruptcies in the Central Valley and elsewhere. One of the things that's driving that is that with this sort of low density use, they're not collecting enough tax revenue per acre to pay for the infrastructure that they've had to put in. And so cities are really starting to look at this from an economic sustainability perspective. And for us in public health, that's great. Because for a place to be healthy over the long haul, the economy has got to be healthy. So that's a real win-win. And so we've been actively trying to develop relationships with developers. I know Jessica and I both just found this out over the next 2 days are going to be involved with a site visit with the Urban Land Institute, which is the sort of, what would you call that? That's like the professional organization of the development community. And the San Francisco Bay Area Urban Land Institute has really gotten onto building healthy communities. And so others are coming from Seattle to see what's going on, positive, negative, and see what they can learn to build more effectively. So complete streets are really about safety, convenience, and comfort. All of those have to be emphasized. It's a urban as well as rural thing. And I want to put this in there because this really has to be context sensitive. So what works in San Mateo isn't going to be the same thing that will work in Fresno. It's not going to be the same thing that will work in New York or in San Francisco. And people are starting to get that. And I think input from the likes of you all to Charette's, I know you've done walk audits, it really comes down, and the success of this comes down to the local level and how local input is brought into it to make the place look the way it will actually work for the local community. Multi-use trails, this is another thing that we're working all over the country on. Really reuse of rights of way. This is an old rail right of way. Once upon a time, the thought was that these multi-use trails are recreational use on the weekend, and the people in spandex will come out and use them. And isn't that nice? Increasingly, planners, especially in rural areas, are starting to see them as ways of increasing regional connectivity, a smart way to reuse infrastructure because a lot of them are on old rail rights of way, and a way to pair places with open space conservation goals. I'll give you a quick story. I've been working in San Bernardino County, up in the high desert. There are a couple towns up there, Hesperia, Adelanto, Victorville, Apple Valley. And we were working to get a shared use agreement to get the high school yard open after hours, but a lot of people were saying, you know, the high school's so far away. we're not gonna ever go there after hours or on the weekend anyhow. Can't you help us, like, you know, what about trails or something like that? There are all these utility rights of way that connect the towns. Can't we build a trail underneath that? And besides, most of them connect to the various schools anyhow, so it would be a good way to build cycling trails where the kids could get to school and they wouldn't have to go on the road. So that's what we're doing. We have to do a bit of work with Southern California Edison, but that's starting to happen now. And so multi-use recreational trails can have a real practical daily transportation benefit. Not just a transportation benefit, but a blight remediation benefit, and an economic development benefit. I've got some slides later on that are going to show the impact of building attractive trails like this on home resale values in Minneapolis and elsewhere. You'll be surprised. Healthier buildings, working around New York State had us help them rewrite their building codes to prioritize stairway accesses. How many times have you been in a building you cannot find the stairs? You have to take the elevator. Our building in Oakland, we're on the 5th floor. We could not walk up. The landlord wouldn't let us. He gave us all these stories. He didn't realize we were a bunch of lawyers and planners who know about building codes. He eventually let us after we convinced him that all his things about safety and the fire code were wrong. But that hasn't redesigned our building. And you're starting to see architects, especially those who build senior housing, really starting to think about how to build physical activity into the nature of the place. Bike parking, that's another, those slides you had from Santa Monica were great. We were on vacation there 2 weeks ago. I didn't know you'd done a lot of that stuff because I saw that bike place. Can you imagine if there were places you had to go and the road didn't connect to it, and there was just nowhere to put your car? How inane that would seem. That's how the bike infrastructure is. And I think that if we really want to encourage cycling, we've got to rethink that and really work on cycle connectivity and make sure that there are safe places for parking. So let me finish off quickly. Recent research, 2011, published by UMass, local jobs created per $1 million spent. You actually get a lot more bang for your buck if you spend your transportation dollars on things other than road-only projects in terms of local jobs created. Other research, here we go. For every quarter-mile near an off-street bicycle trail, the median home value in Minneapolis-St. Paul increases by $510. This is some of the reasons why the Urban Land Institute is starting to get interested in this sort of thing. People want it. People who ride their bikes regularly, the employers want this, okay? The mayor of Oklahoma City, who I mentioned, Cornett, what caused him to get health religion? Oklahoma City was in a contest. You know those beauty contests that cities have every once in a while where a big corporation is looking to relocate? And they lost out. And I don't know the name of the corporation, but the CEO told the mayor of Oklahoma City, you know, you guys have very high obesity rates, and we figured our healthcare costs would be too high, our absentee rates would be too high, and we just didn't want to take on that burden. These are some of the things that corporations are looking at. This is what they're finding for people who bike regularly. I talked about shared use. I'm going to skip through so we can get through to some questions, but to me this is a no-brainer. Schoolyards can and should be open after hours, and it can be done in a way that benefits the schools, but other public lands can and should be used for recreation. Here's one example. This is under the BART tracks in Berkeley.
El Cerrito.
Yeah. El Cerrito, thank you. No reason at all why something like this can't be multi-purposed. This is in Toronto where I grew up. The parks in Toronto have these signs. Please walk on the grass. You know, I really, the great part of my job is working with public agencies to get them to think more creatively about how to work with the public better so that we all get better use of what our tax dollars are spent Building pocket parks near housing so that the kids will actually use it. All of these are important steps. So I just want to thank you all for your time, and we've got some time for questions. So